Welcome to Transfer Training for Healthcare Professionals. The purpose of this video is to provide an overview of transfer training technique and equipment. It is not intended to take the place of practical, hands-on training. The first technique we will cover is a supine to sit transfer. Encourage as much independence as possible from your patient. Have the patient bring both legs over the edge of the bed. Cue or assist the patient to roll towards the edge of the bed. Using the green lifter sheet for support, assist the patient to lift their trunk into an upright position. The healthcare provider closest to the patient's head uses the lifter sheet to give good leverage and eliminates pulling on the patient's body. Notice the body mechanics and how close the healthcare provider's body is to the patient. The healthcare provider closer to the feet will help support the legs with one hand and will use the other hand to pull the patient's hips around into the edge of bed using the lifter sheet. They will then block the feet and knees to prevent the patient from slipping forward off the edge of bed. The next technique is a sit-to-stand transfer. To prevent slipping, the healthcare providers will block the patient's knees and feet. Cue the patient to push with their hands from the seated surface. Cue the patient to lean forward, nose over toes. Provide only as much lifting assistance as required through the upper extremity and hips. Now we'll look at a stand-step transfer with two-person assist. A stand-step transfer involves the patient standing up and stepping from one surface to the other. Place the chair at 90 degrees to the bed surface. Always transfer towards a patient's stronger side. The same cues and technique are provided for the sit-to-stand. Support the patient as required. Once the patient can feel the chair surface on the back of both lower extremities, cue them to reach for the armrests or seated surface and provide lowering support as required. We will now demonstrate the same transfer with a rollator walker. Ensure the rollator walker brakes are applied. Never allow a patient to pull up on the rollator walker handles. Patients should always use at least one hand to push from an armrest or seated surface. Once standing fully upright, remove the brakes. Follow the same procedure. Before sitting, lock the walker brakes and cue the patient to reach back for the seated surface or chair armrest. We will now look at a squat pivot transfer. This transfer is used for more dependent patients or patients who are unable to step. Chair is set at 90 degrees to the bed. Foot position is important. Think about where you need to be to support the patient both on the bed and in the chair. Place the patient's hands around your upper back. Spotter can assist as necessary. Get your stance low. Use rocking to build momentum, getting your center of gravity as close to the patient as possible. Smoothly transfer to the chair. Here's a better view of the healthcare provider's hand support on the patient's shoulder and pelvic girdle. Bed to chair transfer with turn-safe pivot disc. To use this technique, patients must be weight-bearing on at least one lower extremity and at least one upper extremity. Pivot disc is placed in front of the patient. Patient's feet are placed on the turn-safe platform. The patient reaches up to the support handle. Brake is applied to the turn-safe if applicable to that model. If not, use foot support on disc to stabilize during the sit-to-stand. Once in upright position, release the brake or foot support and turn the patient on the disc 90 degrees to the support surface. Cue the patient to sit the hips far back into the seated surface. Slide board transfer from bed to chair. The slide board is used to bridge the gap between the bed and the chair at 90 degrees. Tuck the slide board under a lifting sheet if possible. The patient leans away from the direction of transfer to allow the slide board placement under the patient's hip. Cue the patient to reach across the board, ensuring the flat palm to avoid pinching of fingers underneath the edges of the board. Use the lifter sheet to assist as required to slide the patient along the board. The patient can assist through any weight-bearing upper extremity or lower extremity. Once in the chair, the patient leans away from the bed surface to remove the slide board. Now we will move to mechanical lifts. Our first mechanical lift transfer will be the Sarah lift. The Sarah lift is a sit-to-stand lift and requires patients to be at weight bearing on at least one lower extremity and both upper extremities. The patient must be participatory in the transfer and have decent trunk control. The sling is unique to the Sarah lift and uses clip attachments. It can be controlled either by remote or by the main control unit on the lift itself. The unit is turned on by pressing the green button. It is turned off by pushing the red button. The battery power is displayed on the green screen. A minimum of 2 healthcare providers are required for any mechanical lift transfer. The sling is applied around the patient's waist in a seated position. Ensure a snug fit. The patient's feet are placed on the foot panel. Brakes are applied to the lift. Calf straps can be used around the lower leg to increase control if necessary. The sling is attached by the clips at the tightest setting achievable. The patient is cued to hang on to the hand grips. One healthcare professional will spot the patient while the other will run and maneuver the lift. Cue the patient to stand up with the lift support. Once in full upright standing position, the brakes are removed and the lift is positioned in front of the chair surface. The lift leg position can be adjusted on the remote as necessary to accommodate the chair. Once the lift is in position, apply the brakes and the lift is lowered. Remove the sling and remove the lift. The sling should be taken off the patient before leaving them in the chair. We'll now review a bed-to-chair transfer using the portable Hoyer mechanical lift. This lift can be used in passive situations, as well as rescue situations once a patient has fallen. The Hoyer lift uses slings with loop attachment. Ensure you have the correct sling prior to using the device. The controls on the Hoyer lift are the same as the controls for the Sarah lift. The Sarah and the Hoyer also use the same rechargeable batteries. The loop sling is positioned under the patient inside lying. Ensure proper sling size, which gives coverage for both the neck and the coccyx. Place the leg straps under each leg. The Hoyer lift is a bariatric model which is suitable for up to 600 pounds. Pick the most suitable orientation of the lift's 4-point spreader bar to suit your patient. Hook the sling loops to the lift, ensuring the same loop is used on each side. The leg straps should be crossed before attaching to give extra coverage. One healthcare provider will spot the patient and stay in constant contact with the patient while the other will run and maneuver the lift. Ensure the neck is supported as the patient is lifted from the bed surface. Lift the patient only high enough to just clear the support surface. Set up your transfer to minimize travel between the bed and the chair surfaces. Use the handles on the sling to help pull the patient into a seated position angle. Once the lift is in position, secure the lift brakes. Lower the patient into the chair. Unhook the sling. Remove the lift. And eliminate any pressure points on the patient's lower extremities from the sling before leaving them in the chair position. Finally, we will do a bed-to-chair transfer using the ceiling mechanical lifts. The majority of ceiling lifts use plastic clip attachments for the slings. It is important to check before beginning and selecting the proper sling. Clip slings are color-coded for size. Yellow ribbing indicates small, green ribbing for medium, and blue ribbing for large. Lift movement is controlled by remote for up, down, left, and right movements. Seated angle for the lift can be adjusted on the side of the lift itself, positioning the patient from a supine to a seated position. Test the lift prior to beginning your setup to ensure the lift is charged and in good working order. Place the sling under the patient in the supine position. Ensure proper size to allow coverage from neck to coccyx. Place the leg straps under both lower extremities. Lower the lift and secure all 4 clip attachments. Leg straps should be crossed before attaching. Ensure all 4 points are fully clipped and secure. One healthcare professional will run the lift while the other will spot and support the patient. Keep in constant contact to ensure patient's security and comfort. Use the sitting angle adjustment to raise patient into a seated position while the patient is being lifted. Lift the patient only high enough to just clear the support surface. Set up the transfer to limit how far the patient is moved in the lift and eliminate any gaps between bed and chair surfaces. Lower the patient into the chair position, ensuring hips land as far back in the chair as possible. Remove the lift and return it to the charger immediately. Remove the leg straps to prevent pressure while in the seated position. It's important that you feel comfortable mobilizing your patients and using the equipment available to you. If you have questions, please reach out to your clinical coordinator for further orientation. Safely mobilizing patients is everyone's responsibility. Please make sure that you feel comfortable protecting your patients as well as yourself.